see it. One of the reasons I like to talk about checklists, and there are many tools for QI, and with all these presentations we've done and all the guest speakers have done, you've kind of seen a name here, a different thing here, and this and that. So there are a lot of tools you can use. In Lori's first lecture, she talked about all these run charts and different things you can use. And for me, I really, really like checklists. And I think it's a very not easy, but it's a very powerful tool for how simple it is. So I like to just spend a few minutes talking about checklists. And again, saying the Deming statement of doing the right thing right away. And as Lori said, if there's one quote that you take from this, and if you take that and you can make that possible in your workplace, it is a really powerful change that you're making. So what is a checklist? I think we all can have different definitions, but a checklist is a job aid. It helps us do the many things that we have to do. It ensures consistency and completeness, makes sure that we don't forget things. And it's a to-do list to make it simple. People use checklists in other professions. Actually, checklist is quite new for the health profession, but I think it's been mentioned over and over again, quality improvement. A lot of these techniques come from industrial engineering, the airline industry, other industries that have used these checklists to ensure safety, ensure that everything is done as they're flying a plane. So yeah, definitely pilots use this a lot. And it's one of those things that we're slowly trying to see how we can integrate, and people are finding out, are now showing with data how powerful it can be. So why use checklists in healthcare? This is now a pretty old study, but I still like to really use it. So Peter Pronovost is a physician at Johns Hopkins University, and if you don't know where that is, it's definitely one of the more prominent institutions in this country. Not as good as UW, but it happens. So he did, and we've talked a little about central line infections. So central line, if you're a clinician, is a very essential clinical skill, putting a central line for ICU patients. So you put it, I believe, up here. And as Dr. Alvarado said, whenever you put something, you insert a line into a patient, you're opening it up for infections and many complications. So Dr. Pronovost saw that there was a lot of infections and it was costing a lot of money. There were people dying, and people were then staying in the ICUs longer. These are already ICU patients. Their immune systems are compromised. So he came up with a checklist, and this is what it was. It was wash their hands with soap, clean the patient's skin with chlorhexidine antiseptic, put sterile drapes over the entire patient, wear a sterile mask, hat, glove, and put a sterile dressing gown over the catheter site once the line is in. So what do you think about this checklist? And when you see this, what do you think? Anyone? Sorry? It's not according to what it should be? So what is not according to what it should be? Okay. So you would wear the sterile masks and stuff before putting the sterile drapes. Yeah. Mm-hmm. Mm-hmm.
And then clean the patient's skin
Mm-hmm.
and put it sterilizer.
Okay. So it might be flipped, those two things. Okay, I don't put central lines in. I shouldn't. I'm not qualified. But is there anything else about this when you initially see this that Yep, Connor, and then Chrissy.
This is, I guess, a list that's going to need to be shared with many more people than just the physician. So it's a checklist that's intended for the physician, but like the availability of the soap, having a chlorhexidine immediately available, sterile grades that are present by the bedside, including sterile mask, hat, gown, and gloves, and dressing. These are going to be things that are going to need to also be provided to the physician by other people. And they need to know that these things are going to need to be right there.
Yeah, it's at Johns Hopkins, so hopefully they have that. Chrissy, and then Sindhu.
I was just going to say, let me just briefly read through it. If you ask anyone who puts these in, they would always say these steps are very obvious.
Mm-hmm.
So they would say, of course I do this. Why would I need a list for this? This is something I do.
Yeah, exactly. You show this to a doctor, they might not be very happy. Sindhu, did you have something?
These are the steps I think which everyone should take, but many a times what happens is because these we take as granted and too simple, then we focus it on the more important things, and sometimes we miss this doing these simple steps.
Mm-hmm. Yep, definitely. Thank you for that. And so, yes, I agree with all of you. So these are really simple. It doesn't really say anything about how to do the actual procedure, first of all. It doesn't have anything about the clinical practice of putting in a central line, which in my non-clinical sense is not an easy task, and I couldn't do it, and I shouldn't do it. So what he did was he made this checklist, and he had the nurses observe the doctors do this for a month. And this is, again, at one of the best hospitals, ICU, in the country. And what they found was that at least one of the steps was missed the majority of the time. A majority of the time, at least one. So you're saying that some of the top hospitals in the UW, or in the U.S. are not washing their hands to put something like a central line, which is concerning. But again, it's such a simple thing that people say they're doing, and they are missing these steps. So let's see. After he showed that these steps are being missed, with the blessings of the hospital, and the nurses were given the authority to say something when one of these steps was missed. When the doctor was doing it, usually there's a nurse around, and they were told that it was okay to say, "You missed, doctor, blah, 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 you missed a step." So that was the checklist, and the nurse would go through as the doctor is putting a central line, and after 1 year, they found that this 10-day central line infection went down from 11% to 0%, which is incredible. And after 15 months, there were only 2 infections that entire time, and they saved $2 million, 46 patients who would probably have gotten infections, and 2 to 5 deaths. So that's a lot with just this 5-step checklist. So another reason I like checklists is because a lot of times when we're in low resource settings, we don't have all this money to build a new hospital, build a new thing. Or oftentimes with central line infections, there are catheters you can use that are more expensive, that are aligned with diamonds, not diamonds, but stuff that are supposed to help not get infections. So maybe it doesn't have to be that complicated or high-tech. Maybe there's something simpler that we can do. So he showed that it works, that something that simple can make a drastic change in provision of healthcare. So why checklists are so great, and I really like them, are they help with memory recall, especially with details that are easily overlooked when patients are undergoing drastic events. So like we said, it's very simple, washing hands, putting drapes on. These are things that should be done all the time, but aren't. And it also makes explicit the minimum expected steps in a complex process. Like I said, there was nothing in there about how to put a central line. There's no clinical skills on how to be the best at what you are. But it does say these are the minimum things that has to be there. So you could be a mediocre doctor putting a central line, but that probably means you won't get an infection because you did all these other things right. So there's a higher standard being set for baseline measures. And so, again, going back to what makes a good checklist for healthcare QI, like we go back to this example, is that it's simple, short, cheap, efficient, easy to use, practical, and defines clear pause points. So there's not a lot of technical language in there, and it's only 5 steps. So even for a complex procedure, it can be that. So this is an example. It's in your packet of, even though this both look like it's pretty simple, they go through and talk about why one is poor, like poor incision, pre-incision. What does that mean? It's easy to confuse that pre and post. So simple things that when we're first making a checklist might seem like, oh, pre-incision, it makes sense. But when you test it out, when you ask people, then you realize that there are simple, even visual cues that might make it not a great tool. So there's a lot of testing we should do. So this is the WHO Surgical Safety Checklist, and there's 3 clear sections: before incision, before anesthesia, before incision, and before patient leaves the operating room. And if you look at it, it's pretty simple for what they're going through. It's a surgical checklist, but it doesn't have a lot in there about how to do the surgery at all, because that's not the point. It's about making sure that the right patient is being operated on for the right procedure, and everyone knows who's doing what. And this is another patient care checklist for H1N1, and it's all in your packet, so you have examples. And so recently the WHO started a safe childbirth checklist, and they piloted it in India, and it's 26-step checklist that they use with traditional birth attendant, and they've shown a lot of success in adherence to these core things that need to go right for a safe childbirth process. So while the example I shared was in a high resource setting, checklists are also very usable in low resource setting. So this is from the study on on the different steps it took for them to do the checklist, and they're still working on it. And this is the actual checklist that you can go through later. So the question is, okay, no, that didn't show up. So why are checklists not used often? And I think Christy kind of indicated this, is that, it's so simple that if you tell doctors, did you wash your hand, you might not get a very nice response back. It's insulting to healthcare professionals to be told that they need to do these simple things. And one of the doctors in an ICU said, forget the paperwork, take care of the patients. So as Dr. Redwood said, what if your ICU has floods of patients? You are just trying to make sure they're alive, and you do not have time to do a checklist. So while a checklist in the idea is nice, there needs to be a lot more other things that need to happen for it to work. And the reading that's in your packet for today talks about that. And this whole week we've been talking about how important a culture of quality is, that a checklist without anything else is just a tool that no one's going to use. Just like guidelines, that if some organization makes these amazing guidelines and spends millions of dollars making, and no one uses it because it's like, we weren't involved, we don't know why this is happening. So the culture of quality, making sure people are informed, people are engaged, that people were part of the process to make the checklist or make the tool, is as important as having a great checklist. And if you go back to the Pronovost example, the fact that the nurses could tell the doctors that they are not washing their hands, in how many of your settings is that possible? Is that okay? Yeah, depends.
If you have seen a nurse tell a doctor to wash their hands. Anyone ever seen that?
Where did you see that?
So, my experience with this was in Nicaragua, and there had been a doctor's strike. And during the doctor's strike, the nurses had to follow the protocol and keep things together. And then the QI project came in, and the doctors, they were checking compliance, and there was enforcement from the supervisor. So they had the regional supervisor coming out once a month. And so what the doctor said was, at first, we were really upset when the nurses would remind us. But then we realized that our scores were coming back, and so somebody was coming to check, and we thanked them. So, when you have the whole system trying to work together, people came to appreciate each other. It wasn't easy, but they did accept it.
Yeah, so
If there hadn't been someone checking, maybe some of them still would have accepted it, some of them wouldn't.
so it would be a cultural change in showing that the doctors and nurses are in the same team to have better patient care. And maybe it would also involve other people who are stocking the gauze that, suddenly they're told that it needs to be there all the time. If they're not told why, that it's so that we are explicitly saving lives. How often do the people who use the autoclaves get told that because of them, the patients are safer, are not getting infections? We thank the surgeons. We don't thank the autoclave operator or the person who makes sure there's fuel in the generator, so to run the generators when the electricity goes out. So yeah. And so our checklist, the answer. So, thinking about, as much as I love checklists, thinking about the bigger picture of checklists and why we do have QI institutes like this is that, you can find tools online, just Google it, it'll be there. But it's so much more. There needs to be a culture of change. There needs to be institutional buy-in. And people need to be empowered to make change, to feel like they have a voice in the system. So, can a technical solution solve an adaptive sociocultural problem? And I think it's definitely a piece of the puzzle, but it doesn't solve anything, and it can seem like, oh, we'll just make a checklist and everything will be better. And if it was that easy, it'd probably be done. There are some things that can be easily solved or addressed by a checklist. That's why I love it. But then a lot of times it does involve making sure people know what it is and how to use it, whether we're burdening the nurses who are oftentimes already have so many responsibilities, and how do we make sure that they can absorb that to their workload. So here's some references, and if you want a read, Atul Gawande, who's a cardiothoracic surgeon, a surgeon of some sort, and wrote about checklists. Checklists have been around for many, many years in healthcare, but he was just the one who wrote it up in a very riveting manner and made millions. But he's a great writer. His book, The Checklist Manifesto, is great. It does a good job talking about the history and why we should use it. So I would encourage you to read it.